Therapeutic Use of Cannabis in Palliative Care. A book written by Pharmacology University. Narrated by Sandra Loaiza. Introduction. The cannabis plant has been used for medicinal purposes for more than 4,000 years by different civilizations. The first recorded evocation of the therapeutic use of cannabis was in the classical Pharmacopoeia, transcribed by the legendary founder of Chinese medicine, Emperor Shennong, in 2737 BC, who used it for medicinal properties such as pain relief, rheumatism, and gout. Dioscorides, a Greek physician and pharmacologist, collected information on his travels about the healing properties of plants, including cannabis. The book De Materia Medica, written by him, who is considered to be the founder of pharmacology, describes cannabis as one of the natural substances that can alleviate inflammatory pain. On the other hand, Galen, 131 to 200 after Christ, a Greek physician and philosopher, reported in one of his therapeutic treatises that cannabis seeds were of heavy digestion and harmful to the stomach and head, but relieves gas, and suggested the use of the juice of the whole herb, green, placed in the ears to combat the pains produced by obstructions. He referred to its consumption as relieving the muscles and limbs. From the beginning of the 20th century was when the discrediting of the use of cannabis began through a series of state and local laws. In 1937 in the United States, a federal law, called the Marijuana Tax Act, definitively prohibited its use and sale. However, interest in its therapeutic use increased in the 1960s after the discovery of the main responsible for the psychoactive properties of the cannabis plant, THC. This important phytocannabinoid was isolated in 1964 by the Israeli medical chemist Raphael Mechoulam. It was later discovered that several components of the plant were coupled to a special type of receptors, distributed throughout the body. This set of receptors is known as the endocannabinoid system, and is now known to be involved in multiple physiological processes, such as homeostasis, and the maintenance of a stable internal environment despite fluctuations in the external environment. There is some evidence that certain medical cannabis products may be useful in treating the following problems: epilepsy, multiple sclerosis, symptoms associated with cancer and cancer treatment, such as nausea, pain and loss of appetite, pain, palliative care symptom relief, Parkinson's and Alzheimer's treatment. Join us as we explore the impressive world of medical cannabis and its therapeutic use in palliative care, as only Pharmacology University can show you. Chapter 1. Palliative Care.
J'étais malade et vous êtes venu.
Sample complete. Ready to continue?